Rheumatoid arthritis is a systemic autoimmune disease that affects joints of the wrists, hands, elbows, shoulders, knees and ankles symmetrically. So if you get it in your right wrist, then you'll get it in your left one. And it causes pain and damage. So the synovial membranes, also called the synovium, of the joint become inflamed and produce fluid which accumulates at the joints, and this causes them to become pitted and eroded. Some symptoms are nodules and lumps around the elbows, joint stiffness and loss of function and deformities, foot pain, bulges and a hammer toe, and then some whole body symptoms are fever, lack of energy and a loss of appetite. It is called an immune-mediated inflammatory disease, and it can be caused through inheritance and environmental stimulus. So an example of environmental stimulus or genetics is citrullination. This is a normal process converting between amino acids. Environment and gene interaction can cause a loss of self-tolerance to proteins with this citrulline amino acid residue. This then causes T and B cells to produce anti-citrulline antibodies or attackers, which then results in inflammation. This causes swelling and degranulation, degradation of the bone and cartilage. It tends to be diagnosed through blood tests, such as testing for the rheumatoid factor and the anti-citrullinated protein antibody test. And sadly, there is no cure. We can only treat the symptoms. Multiple sclerosis is an autoimmune disease caused by the destruction of the myelin sheath. The main big things of damage that this causes are brain and spinal cord lesions, sensory disturbances, reduced muscle control and visual disturbances. These result in symptoms such as neuropathic pain, learning and memory problems, emotional changes and depression, gait and mobility problems, vision issues, sexual dysfunction, dizziness and vertigo. It tends to be diagnosed by a combination of physical and neurological examinations, such as MRIs of the brain and spinal cord to show if these lesions are present, spinal fluid analysis to show if any antibodies are present, evoked potential tests, which test the electrical activity in response to certain stimuli. And sadly, there is no cure for this. We can only give things to treat the symptoms. The last systemic autoimmune disease that I'm going to talk about is, I'm just going to abbreviate to SLE. This causes notable red skin lesions and is a chronic multisystem inflammation disease that mainly affects females again. Some clinical manifestations are musculoskeletal pain, so pain in the joints and muscles, the dermatological feature of the red lesion and rash, and then renal complications. Some symptoms of these manifestations are fever and photosensitivity, ulcers, aches and rashes, fatigue and a loss of appetite, and inflammation. We don't know why it's caused, but we think that it can be a combination of genetics, race, hormones, and the environment. It's diagnosed through symptom assessment, if there's a family history, image testing such as X-rays and echocardiograms, and kidney and skin biopsies testing for antibodies, doing a complete blood count, and liver assessments, kidney and liver assessments. The treatment depends on the symptoms and the signs. Some examples being immunosuppressants, corticosteroids, anti-malarial drugs, and biological therapies such as specifically targeting specific immune cells.